Just go over, if you can, how when people hear more transmissible but looks less severe, how that is still a massive concern just based on sheer numbers.
Yeah, absolutely. So first I would say looks less severe is really early data. If we have a much more transmissible variant, you end up with a much larger population of people with disease, and then even small amounts of that very large population that end up in hospital you end up with a real crisis at the hospitalization level and potentially lots of poor outcomes.
A question I'm sure you get probably daily about masks. Are they here to stay?
Oh gosh, I hope not. Nobody wants them to be here to stay. I will say masks are for now. They're not forever. We have to find a way to be done with them. But I do think that the more people lean into the current moment and we can decrease the amount of cases of Delta and prevent Omicron from coming to the extent that we can, we will reach that time sooner. The data we have on COVID Data Tracker right now is you are 14 times more likely to die, 11 times more likely to be hospitalized, and about 6 times more likely to be a case if you are unvaccinated.
You've been very cautious about saying that for now the definition of fully vaccinated has not changed, but it could in the future. Is there an update on that?
So for now, the definition of fully vaccinated is 1 dose of J&J or 2 doses of one of either Pfizer or Moderna. We are looking at the data right now. We're right in the middle of a time when we're going to have a lot of science. What does the protection of the booster mean for Omicron? What are we seeing in the protection of the booster for Delta? How much Omicron is going to be here, and what is the, do we need an Omicron specific booster? And as those data, just in the last 24 hours, we've seen data emerge and numerous studies emerge. So as those data are emerging is where we will look to see if that recommendation needs to be changed.
And so what does the off-ramp for the pandemic look like as it goes into maybe being endemic?
There are several reasons why I definitively don't think we're there in this moment. One is we've gotten pretty cavalier about 1,100 deaths a day. 1,100 deaths a day. I can't be in a position where that is okay, especially since, unlike influenza, we have a vaccine that works 95% of the time. The vaccine works so well. And so I can tell you we're not there yet. We are looking at thinking about what are the off-ramps going to look like. We certainly can't have hospitals at exploding capacities. We can't have 1,100 deaths a day. And those are going to be some of the really important benchmarks that we're looking at.
A question on the minds of so many parents and grandparents, as well as some pediatricians, short-term safety for the pediatric vaccine, as well as long-term safety. Now you have quite a few pediatric doses given. What is the safety profile looking like?
It's been, certainly those, data take time to look at and collect, but so far there have been no signals. And so that's none. That's really encouraging. And in fact, the one that everybody was, most talked about was myocarditis. And myocarditis in general happens less often in the pediatric population. So we were less worried about that one to begin with, but we haven't seen anything yet. So we we continue to follow. We have an incredibly robust vaccine safety system, and so if they were there, we will find it. But we have nearly 5 million children. I would say, if you want your children fully vaccinated by the holidays, now is the time. We have given billions of these vaccines around the world, and we now have 2 years worth of data for nearly 200 million people who've been fully vaccinated. And there isn't a single vaccine that has that long-term effect that we know of. So I think we're on really solid ground. And there's 14 times the number of deaths associated with not being vaccinated right now.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.